All right, the United Kingdom is struggling with a spike in coronavirus cases. The city of Blackburn, just north of Manchester, reporting the highest infection rate in the country. Staffers in the area's main intensive care unit enduring abuse and unrelenting pressure, with 1/3 of their patients dying this past weekend. Just tragic. CNN's Nick Payton-Walsh just visited the hospital. He joins us live from Blackburn. What'd you see?
I have to say, Christine, it's quite startling. The UK really, by some measures, hit the worst during the first wave across Europe. Now the second wave is certainly upon them, and it's patchy. Certain areas hit hardest, and this Blackburn has the highest infection rate for new infections in the last week in England, and nowhere more clearly do they see it than in the ICU behind me. As you said, 1/3 of their patients dying in that unit since Friday. 8 people themselves. Quite startling, and the pressure upon the staff there from those locals who don't want to follow social distancing, who don't want to obey the rules, adding to the pressure on staff here that has been so relentless. Here's what we saw. In this, one of Britain's hardest hit ICUs, the worst of the pandemic isn't behind them, it's just happened.
We've also had 8 deaths. It's been the worst weekend that we've had. And that's the problem, because you have a death and unfortunately there's somebody to go in that bed. Change mattress, next patient.
1/3 of the COVID patients in this ICU have died since Friday. There are 197 total in the hospital, 30 new this weekend. Outside, the northern city of Blackburn last week had the worst rate of new infections in England. What's extraordinary is just how frenetic, how busy this ICU ward is.
So on Sunday afternoon, it was literally patient in, stabilised, but it was almost doing traffic control to make sure that they weren't banging into each other when they came in.
The pandemic never really eased for summer here. They're exhausted by only 2 weeks since March without a COVID patient.
And it's when I see those very senior, experienced nurses, it's when I see them crying. It's when I don't really have an answer, but it's when they say, yeah, but when? When's it going to end? When are we going to get back to some degree of normality?
But they are also exhausted by a general public disobeying and angry at the rules.
You know, we've given absolutely everything, and yet we're being called liars, and we're being abused on the phone, and there's nurses withdrawing treatment on patients and doing end of life on a Zoom call, and having a wife or a husband or a daughter on the other side of that camera crying and saying, please will you hold my dad's hand, please will you do whatever, and then the next telephone conversation might be somebody hurling abuse down the phone at them. Unfortunately, on several occasions we've had to stop the Zoom calls because there's been numerous relatives in a room, not social distancing. The other day there was at least 45 in a room, so we had to stop it.
Better treatments keep the patients conscious now, able to talk clearly of how dangerous the disease is. Retired carpenter Jack has no idea where he got it or why people insist on breaking the rules.
Ridiculous. I just can't understand that, why they do it. They have no idea for the consequences of it, you know.
It really does weigh you down when patients in work are really unwell and dying in a very specific way, and yet there's people who know nothing about the virus saying that it's not real and it doesn't exist. Yeah, last weekend on my nights, as soon as I arrived here, a lady had come to the ward and unfortunately passed away almost immediately. You know, giving some relatives a bag and a stick of a lady who has passed away in the bed in front of them. It's quite difficult. It's difficult for them and it's difficult for us as well.
While outside may seem to want to be less aware of the disease, inside they grow more aware of its victims' suffering and its stark, random viciousness. Is there one thing that you've learned about this disease in the last 7 or 8 months?
You can't read it, and I hate it. From the pit of my stomach, hate it.
You know, what is startling is the UK's national conversation is still very much debating the severity of the wave ahead of them here, whether social distancing restrictions are entirely necessary. That debate rages every single day, but there is no debate at all behind me here. Yes, certainly one part of England, not all of it, but it is increasingly deadly, it seems, this disease to people locally here. It seems, anecdotally, to the staff here, a disease that outsmarts them, that's so hard to read, as you heard there. And also, too, the change in the treatment they're able to give patients leaves them conscious, leaves them often in so much better condition, but still occasionally prey to sudden deterioration. But it also means those relationships between the carers and the patients are stronger because they're more conscious, able to talk. And that toll upon the staff, you saw it there, so distinct and so palpable behind these doors here. And the real fear is they're going to see this get worse. It's so busy in there, so much busier than the ICUs we've seen around the world, and startling to see this picking up again. Christine?
Nick, thank you so much for, going behind those doors and showing us that story, because I think you have some fatigue in this country too, people tired of mitigating and changing their behavior, but really important to see what's really happening there behind those closed doors. Thanks, Nick.